Together we achieve victory over heart failure.
Hi, myself Dr. Rahul Ramteke. I am senior interventional cardiologist working in Delhi NCR region, and I have been practicing for more than a decade here. And today I'll be discussing few things which we must know about heart failure. So exactly what is heart failure? So first we'll try to understand what is heart failure. Once the heart is not able to do its function properly, that is pumping blood, that function loss is known as heart failure. So if the heart is not able to pump properly, it leads to low blood pressure and symptoms such as breathing difficulty. The early signs of picking up heart failure are mostly breathing difficulty, extreme weakness, fatigue. These things can give a clue that patient is probably suffering from heart failure. In such condition, patient needs to follow up with a cardiologist, and we need to do some basic tests such as an ECG to start with, followed by an echo test, and if required, some blood markers like natriuretic peptides, troponins, etc. We also need to see what is the status of his kidneys, thyroid, to find out whether there is any reversible cause for his heart failure. Heart failure is most common cause of death nowadays, and we are seeing that around 40-50% of the global population of heart failure is there in India. And we have to effectively treat them. The most common reason for heart failure in India is first is hypertension, second is coronary artery disease. Then subsequently, diabetic patients, kidney patients, these kind of patients may also develop heart failure. Now, most of these patients require regular drug treatment, and if the drugs are not taken properly in proper doses as prescribed, then these patients may not get full benefit and they still might get intermittent attacks of heart failure requiring admission. So we have to be sure that once we are diagnosed with heart failure, we have to take medicines very regularly and we have to take them as it is prescribed by doctors. The medications may need to be titrated follow-ups because there is a seasonal variation in the requirement of drugs. Most of the heart failures do occur in winter season when the BP tends to increase. So most of the heart failure tends to occur in winters when the blood pressure tends to increase. And in summer seasons, most of these patients will tend to get side effects of medication. So we have to be on a regular follow-up with our cardiologist and ensure that our medications are titrated as per the seasonal patterns. Always try to take your drugs on a regular time as prescribed. And we should have a habit of monitoring our BP at home along with our body weight. Patient should also control his salt intake and fluid intake because these two are the most common triggers for heart failure. So if you take an excessive amount of salt or take an excessive amount of fluid in any form, be it water, tea, coffee, juice, or anything, if we take it in an excessive quantity, they may precipitate heart failure. So we should always ensure that the fluid balance is also in a proper way in our body. We should try to avoid doing strenuous activity or avoid exercises such as lifting heavy objects because they can suddenly precipitate heart failure and lead to breathing difficulty in a heart failure patient. There are new drugs in market which have been recently introduced and most of the cardiologists are well aware of it. So try to show it to a cardiologist so that you are treated with the recent guideline directed therapy so as to maximize your benefit. With this, I shall like to conclude my talk on heart failure. Thank you for listening. Stay connected.